Hi everyone, Dan Julian here, nurse practitioner for Danesthetics Medical. My clinic is located here in Ottawa, Canada. You know, neuromodulators for the forehead is one of the first things we learn how to treat as an injector. But it's also one of the most complex things to get right, especially on the first try with a new client. So today I'm going to be showing you various techniques on how to address the forehead. I'm going to be showing you introductory techniques and also advanced techniques to help you get it right the first time. I think you guys are going to really like this. Let's get into it. Okay, so to kick things off, let's do an introductory approach to treating the forehead with toxin. First off, which muscles are we treating? The two frontalis, right here. These muscles are right beside each other, and whenever they're contracted, they go up. Whenever they're relaxed, they go down. By placing more toxin in it, they go down even more, and we're afraid of this happening. So we need to address how low can you inject on the forehead without causing heavy eyebrows. And that's the first thing I always address. Take a look at Stuart here. Stuart has a cut line right here, and it's 2 centimeters above the brow. The bone here, this orbital rib. So not the eyebrow itself, but the orbital rim. So you need to feel that. Sometimes the eyebrows are a little lower, sometimes they're a little higher, and you need to feel this rim. 2 centimeters above the rim is your cut line, and you don't want to inject anything below that whenever you're doing the frontalis, otherwise it's going to drop those eyebrows. Next is, where should I place the toxin? Well, I always look at this temporal crest, and in 98% of the clients, you're going to want to treat in between these two areas. Where's the temporal crest? Well, that's these orange areas that I've marked on Stuart here, and here's my temporal crest. If you want to feel it, feel the forehead, and it's the division from the forehead to the temporalis zone. So there's going to be a bony ridge here, and that's your temporal crest. Last thing is the height of the forehead. So if someone has a shorter forehead, you're not going to need that much Botox. But if they have a higher forehead, then you may need to place a little bit more to engage all the wrinkles. Keep it simple. Here we go. Okay, so here's my first introductory approach to toxins. Basically, this is a 6-point approach that works really well for a lot of people. And basically what's nice about this is that it's pretty variable. You can use this almost on everyone, and you usually get a good result. It's great for people who want to go conservative, and you can place 1 unit here in each area and they'll have a nice mild conservative result. Someone who's younger, who doesn't have a lot of lines, this is a great way to introduce them to toxins. It's also a great pattern to use whenever you are dealing with a shorter forehead. The other thing you can do with this is keep this pattern and add an extra 1 or 2 units to it, to each point. And that's just going to make that area more concentrated, and it's just going to relax the lines that much more. And the more you use, obviously, the less movement. So take that into consideration. Okay, next is my 10-point approach. This was kind of my go-to whenever I first started with neuromodulators. It worked really well for a lot of my clients. It gave me a nice dispersion of the product throughout the entire 2 frontalis muscles, and I usually placed 1 unit in each of these points. If someone's looking for a little bit more aggressive treatment and they're looking for a little more stiffness, you just have to add an extra one, so it's a total of 2 units in each point, and that's going to work really well. Notice how it's displaced, right? It's all evenly distributed. You've got 2 on top, 2 at the bottom, 1 in the middle, and they almost all connect to give you that nice even distribution. All right, so now we're getting into the advanced techniques and what I look at whenever I'm treating the forehead. Hi everyone, this is Dan Julian, nurse practitioner for Danesthetics Medical Premium Edition. On my free YouTube channel, you've had insight on how I treat patients using advanced filler techniques that I've learned throughout the world. In this paid subscription model, I'm unlocking everything else. Fillers, Botox, fat dissolvers, and in the near future, thread lifts. This is going to be done with live demos and at the same time with my assistants Sarah and Stuart. Your subscription includes an updated tutorial video every other week that only you have access to. Not only that, I'm going to be going live. Yep, I'll be doing live streams on the alternating weeks. So we'll be talking about cases, we can chat together. It's going to be very personable. So join me. Let's try something different and make a community out of this. I think you guys are going to really like this, and I'm really excited for it. I'll see you soon. First off, I'm looking at how strong is this muscle? Is this, are these 2 muscles really weak? Not much is happening. They only have a few minor lines, or are there multiple lines and they're thick? And when they contract, they go all the way across. So that's one thing I look at, because that's going to give me an indication how much I need to use in one given area. Am I going to use 1 unit here? Am I going to use 3 units in this one particular poke? And that's going to help me, right? Next is, are there any irregularities in the muscle pattern when they contract? Now, there's a couple different things that I mean by that. So let's take a look at Sarah here. And Sarah's forehead has an irregular pattern. If you notice on her right side, the right side seems like it's not contracting as much as the left side. And you'll see that in clients. Basically what's happening here is she has more pull on her left frontalis than on her right. So that tells me I'm likely going to have to place an extra unit here. And if not, it's almost guaranteed that in 2 weeks she's gonna come back and she's gonna say, whenever I raise my eyebrows, this one's peaking higher than that one, and she's not going to be happy. So that's one thing I take into consideration. The next thing that I look at is this temporal fusion line right here, the temporal crest. Typically 98% of your clients, their wrinkles are going to go across all the way up until this temporal crest, but they usually don't go beyond it. But take a look at Sarah here, and Sarah's basically go just beyond it. And that tells me that if I'm not careful, if we don't place anything over here, then she's likely going to have pull, and whenever she raises her eyebrow, she's gonna get a good yank over here and nothing throughout the middle. So we have to take that into consideration. And the last thing that I look at is the hairline. And basically what's really interesting about the hairline is that there's about 3 to 4% of the population that when they raise their eyebrow, their forehead, their scalp actually moves forward. And you have to take that into consideration. If their scalp is moving forward whenever they're raising their forehead, and if you do not inject just underneath the scalp line, they're gonna have a big indentation here with a big wrinkle, because you're going to block all this and it's going to force the scalp to move even more. So always take that in consideration. Those are the things that I look at before I do any injections. So this is how I approach these more complicated cases where we have a little bit of irregularity, where it's not a perfect symmetrical pattern across the forehead, or if it extends beyond the temporal crest. So basically, let's bring up Sarah. And what I've done here is I've taken kind of a combination of the basic principles of the patterns that we use and just added a couple extra that I felt. So she has a shorter forehead here, so I don't think we need the whole 10 point. We're gonna use a 6-point technique, right? 1, 2, 3, 4, 5, 6. But because she has more movement here, I'm going to place an extra unit right there. Now, if you take a peek here, I've also added an extra unit high up on the temporalis here, because she has these lines that extend into the temporalis. The reason why I'm not placing that lower is because typically, whenever we place even a small amount of product here, it's going to lower that eyebrow. That lateral eyebrow heaviness is really what we don't want. So I place that 1 unit nice and high, and it does a great job of just preventing that spot brown. I place it on both sides. So 3 extra units for this client, just to give me that look that I'm hoping for. Now here's another classic example of a client that you will likely see. He's a little bit more complex than most, because when he raises his eyebrows, it's not straight lines across. He's got a wavy pattern, and they typically peak where? Right in between almost the midpoint of that eyebrow on both sides. So we have to address that. The other thing too is that I find that he's pretty strong in the middle whenever he's raising his forehead. So I may want to consider adding 1 unit there as well. He also has a larger forehead, and he has a lot of wrinkles. So I need to ask this client, A, are you looking for a more conservative approach? Do you want still some natural movement, or do you want this, to be a little bit more frozen, and do you really want to try and efface these lines as much as possible? Here in Ottawa, most of the time people like more naturalistic approach, so I'm going to use my 10-point approach on this person, but I'm going to use 1 extra unit at the areas where I feel he's contracting a little harder than normal. So let's take a look over here. So basically here's Stuart and basically our 10-point techniques. And what I've done is I've added an extra unit right where this extra peak is on both sides. And because I find that he's contracting pretty hard in the middle, I've also added 1 unit there. And in the end, I think that's going to do a really good job of preventing some peaking or irregularities at the follow-up treatment in about 10 to 14 days. These techniques that I'm using are basically how I approach clients. Everyone has their own unique way of how they treat the forehead. I think that as you develop into your own type of injector and own type of personality, you're going to have your own skill and own unique way of how you treat the forehead, which is awesome. I'm just trying to help you with your confidence and give you a little bit more insight on what to look at whenever you're treating the forehead. So until the next time, take care of each other, exercise daily, and please be nice to absolutely everyone. Take care, guys.